Karina Martinez.
And I am Eduardo Chicago.
And we are going to talk about why people trust in alternative medicine. I had firstly like to begin with a brief summary about the concepts that we are talking about. Alternative medicine consists of practices claimed to have the healing effects of medicine, but which are disproven, unproven, impossible to prove, or are excessively harmful in relation to their effect, and where the scientific consensus is that the therapy does not or cannot work because the known laws of nature are violated by its basic claims, or where it is considered so much worse than conventional treatment that it would be unethical to offer as treatment. Alternative therapies or diagnoses are not part of medicine or science-based healthcare systems. Alternative medicine consists of a wide variety of practices, products, and therapies, ranging from those that are biologically plausible but not well tested to those with known harmful and toxic effects. The World Health Organization defines traditional medicine as the sum total of the knowledge, skills, and practices based on the theories, beliefs, and experiences indigenous to different cultures, whether explicable or not, used in the maintenance of health as well as the prevention, diagnosis, improvement, or treatment of physical and mental illness.
Complementary and alternative medicine is the term for medical products and practice that are not part of standard medical care. In the CAM, the treatments are used along with the standard medical treatments but are not considered to be the same. One example is using a computer to help lessen some side effects of cancer treatment. Another example is using a special diet to treat cancer instead of anti-cancer drugs that are prescribed by an oncologist. The integrative medicine is a total approach to medical care that combines standard medicine with the CAM practice that have been shown to be safe and effective. They treat the patient's mind, body, and spirit. A part of the CAM is the traditional medicine, and that are the systems of medicine developed before the era of modern medicine, based on cultural beliefs and practice handed down from generation to generation. Complementary and alternative medicine is based on the belief that a medical care provider has to treat the whole person, the body, mind, and his spirit. The techniques used in CAM are mostly less invasive than conventional medical practice, meaning that they don't rely on surgery or conventional medications. Some CAM therapies are supported by scientific evidence, others are not. Many still need to be studied. This doesn't mean these therapies don't work. It just means that experts haven't studied them enough to know if they do, and if so, how.
In another way, we have the conventional medicine, which is based on scientific knowledge of the body and use treatments that have been proven effective through scientific research. Doctors are trained to have thorough knowledge of the body's system, diseases, and treatments. Standard medical care is medicine that is practiced by health professionals who hold a medical doctor or doctor of osteopathy degree. It is also practiced by other health professionals, such as physical therapists, physician assistants, psychologists, and registered nurses. Standard medicine may also be called biomedicine or allopathic, Western, mainstream, orthodox, or regular medicine. Some standard medical care practitioners are also practitioners of complementary and alternative medicine.
The question of this project is why people believe in alternative medicine. And regarding this, we can say that the people often turn to CAM when they have a long-lasting problem that conventional medicine has not completely cured. Someone might try complementary health approach to help improve symptoms or manage side effects from conventional treatments. People may also use CAM when they are not sick, because many people believe that CAM approach, such as practicing yoga or taking dietary supplements, can improve overall well-being. Also, healthy people often use alternative medicine to try to prevent illness or ensure a healthier lifestyle.
Although complementary and alternative medicine does have some proven benefits, like anything, it has its limitations. Experts have not researched many complementary and alternative supplements and practices enough to tell how effective they are as treatments. Some people may not feel it's worth investigating a lot of time or money in treatments that have not been proven effective. Insurance policies do not cover most complementary and alternative medicine treatments, so people may have to pay for them out of their own pockets with no reimbursement. Alternative healing approach on their own may not be enough to help a person get well. For example, a bacterial infection needs treatment with antibiotics, and just like traditional medication, dietary supplements may have unwanted side effects.
Another reason you should be upfront with your doctor about CAM is because in some cases, some natural products can actually interfere with traditional medical treatments. For example, certain herbal supplements can interfere with some prescription drugs such as birth control pills or antidepressant medication. That's why it's always best to see your doctor if you have a health problem and talk openly about CAM you are using or might want to try. As with modern medicine, CAM treatments that are effective for one problem will not help with all problems. Certain treatments are only used for certain problems, so if you want to try an alternative practice for a health reason, make sure it will help the specific problems you are looking to treat.
Some examples that we have in the complementary medicine is the acupressure, acupuncture, and one more popular in Mexico, the plant of moringa. Acupressure is similar in practice to acupuncture, only no needles are involved. Practitioners use their hands, elbows, or feet to apply pressure to specific points along the body's meridians. According to the theory behind acupressure, meridians are channels that carry life energy, ki or chi, throughout the body. The reasoning holds that illness can occur when one of these meridians is broke out of balance. Acupressure is thought to relieve blockages so energy can flow freely again, restoring wellness. More research is needed, but pilot studies have found positive results. Acupressure might decrease nausea for chemotherapy patients and reduce anxiety in people scheduled to have surgery. The acupuncture describes an array of procedures that simulate specific points of the body. The best known variety consists of penetrating the skin with thin needles, controlled by a practitioner or electrical stimulation, and it is currently used by millions of Americans each year. Despite its popularity, controversy over acupuncture's efficacy abounds. Some studies find it helpful for chronic pain and depression, but evidence on all counts is mixed.
Moringa is a plant that is native to the sub-Himalayan areas of India, Pakistan, Bangladesh, and Afghanistan. We also have moringa here in Coahuila, Mexico. The leaves, bark, flowers, fruit, seeds, and root are used to make medicine. Moringa is used for blood disease, arthritis, asthma, cancer, constipation, diabetes, diarrhea, epilepsy, some stomach pain, stomach and intestinal ulcers, intestinal spasms, headache, hair problems, high blood pressure, kidney stones, fluid retention, thyroid disorders, and bacterial, fungal, viral, and parasitic infections. Moringa is also used to reduce swelling as an aphrodisiac, prevent pregnancy, boost the immune system, and increase breast milk production. Some people use it as nutritional supplement or tonic. Moringa is sometimes applied directly to the skin as a hair killer, or drying a hand. It is also used topically for treating pockets of infection, athlete's foot, dried fruit, gum disease, snake bites, warts, and wounds. Oil from moringa seeds is used in food, perfume, and hair care products and as a machine lubricant. Moringa is an important food source in some parts of the world because it can be ground cheaply and easily, and the leaves retain a lot of vitamins and minerals when dried. Moringa is used in India and Africa in feeding programs to fight malnutrition. The immature grain pods are prepared similarly to green beans, while the seeds are removed from mature pods and cooked like peas or roasted like nuts. The leaves are cooked and used like spinach, and they are also dried and powdered for use as a condiment. The seed cake remaining after oil extraction is used as a fertilizer and also to purify well water and to remove salt from seawater.
Now, we are talk about this subject in different stages for a better description of the topic. Point number 1, what do people believe in? People in United States, according to the 2002 National Health Interview Survey, which made interviews to 75,764 people in 29,266 families, 1/3 of adults use form of complementary and alternative medicine. Between 2002 and 2007, there was a significant increase of all alternative therapies. Complementary was most often used to treat back pain or back problems, head or chest colds, neck pain or neck problems, joint pain of sickness and anxiety or depression. Cane use was most prevalent complementary and alternative medicine among women, among adults who had higher educational attainment or who engage or leisure time physical activity, as well as among adults who had one or more existing health condition or who made frequent medical visits in the prior year. In 2007, adults in the United States spent $33.9 billion out of pocket on visits to complementary and alternative medicine practitioners and purchased complementary and alternative medicine products, places, and materials. Then we have people in Australia that show us throughout an interview that 52.5% of the population use complementary and alternative medicine. The greatest percent was in women aged 25 to 34 years with higher income and education levels. Complementary alternative medicine was used mostly to maintain general health. Among complementary and alternative medicine users, 57.2% didn't report the use to their doctor. The total extrapolated cost in Australia of complementary and alternative medicines and complementary and alternative therapies was $2.3 billion in 1 year. So the conclusion that are the complementary and alternative medicine are used by a lot of people, which don't know all the information and spend a lot of money just for a hope. In Mexico, most people use alternative medicine for certain types of illness like cancer. Many patients use this type of treatments. The use of complementary and or alternative therapy is frequent among young women with advanced cancer and high level of education. The family participates in the decision of using these methods. Most users noticed a benefit in their general condition and reported tranquility. These patients may be prone to higher incidence of depression and anxiety. The effectiveness and safety of this type of treatments remain to be determined, as well as the possible interactions with conventional therapy. Complementary and alternative medicine used in Mexican children is common, most frequently with herbal therapies. The majority perceive benefits with its usage, but in most cases, the treating physician was not informed about this practice.
Point number 2. Why do people believe that? People believe in CAM because they have to believe in something. With over the years, standard medicine have changed and people too. People live to believe in standard medicine because doctors are not 1% honest and this brought consequences. Also, many people use CAM like second option. They take standard medicine like a third option and they look for another method to feel better. Point number 3. If they have information will change their conviction. A study in the city of Boston showed that if people know about adverse effects through diffusion of campaigns, their thinking about death is change methods.
Adults are people that use more the complementary and alternative therapies, and of these, women are the most prevalent group. And something important is that a lot of people with higher income and education levels use the complementary and alternative medicines therapies. In United States, Mexico, and Australia, there are a lot of money invested in the alternative medicine. The most common therapy used by people is the supplements, and is used principally for chronic diseases. People believe in complementary and alternative medicine because they want hope and they are searching some heal to their illness. We can see this in the people with higher income and education, searching something that the standard medicine does not give to them. Also, the complementary and alternative medicine is used in some cultures as a traditional or generational medicine, but it is not frequent.
The prevalence of the complementary and alternative medicine was increased in the past of the years around the world. This means that people start to believe more in CAM than in standard medicine, or they use both to help their problems. It's important to say that if the CAM doesn't get a control or prove his benefits and adverse effects, we cannot admit that is the solution in the medicine, because maybe we are giving false hope and false information to persons. First of all, we need studies that support this type of medicine, and then we need to teach people about that. The use of alternative medicine doesn't mean that it's wrong, but the most dangerous thing here is that we don't have information of that effects, and nobody worry about search it.